First, I would like to give you a definition of this disorder. Rett syndrome is a rare neurological disorder that affects the way the brain develops and primarily occurs in girls. They have typical early growth and development, but then their motor skills and language begin to regress. Over time, children with Rett syndrome have increasing problems with the use of muscles that control movement, coordination, and communication. Rett syndrome is caused by mutations on the X chromosome on a gene called methyl-CpG binding protein 2, or MECP2. This gene provides instructions for making a protein that is critical for normal brain function. Because the MECP2 gene does not function properly in individuals with Rett syndrome, insufficient amounts or structurally abnormal forms of the protein are produced and can cause other genes to be abnormally expressed. Rett syndrome is a genetic disorder and not inherited or passed from one generation to the next. Most cases are spontaneous, which means the mutation occurs randomly. Rett syndrome in boys can be fatal. Because boys have only one X chromosome and one Y chromosome, they lack a backup copy that could compensate for the defective one, leaving no protection from the harmful effects of the disorder. Most of them die before birth or in early infancy. Here are some of the symptoms associated with Rett syndrome. Brain growth slows after birth. Smaller than usual head size or microcephaly is sometimes the first sign that a child has Rett syndrome. Loss of movement and coordination skills include reduced hand control and a decreasing ability to crawl or walk. Children with Rett syndrome typically begin to lose the ability to speak, make eye contact, and communicate in other ways. They usually develop repetitive, purposeless hand movements which differ from child to child, and tend to have unusual eye movements such as intense staring, blinking, crossed eyes, or closing one eye at a time. Breathing problems such as hyperventilation tend to occur during waking hours. Apnea can occur during sleep. Children with Rett syndrome may become increasingly agitated and irritable as they get older. Periods of crying or screaming may begin suddenly for no apparent reason and last for hours. Multiple seizure types may be experienced at some time during their lives. Scoliosis is also common with Rett syndrome. It typically begins between 8 and 11 years of age and progresses with age. Irregular heartbeat is a life-threatening problem for many children and adults with Rett syndrome and can result in sudden death. The symptoms, progression, and severity of Rett syndrome can vary dramatically from one person to another. There are 4 stages of Rett syndrome, which include early signs, regression, plateau, and deterioration in movement. Stage 1 typically begins between 6 and 18 months of age. Infants may begin to show less eye contact and have reduced interest in toys. Delays in gross motor skills such as sitting or crawling occur. Hand-wringing and decreasing head growth may occur, but not enough to draw attention. This stage usually lasts for a few months but can continue for more than a year. It is often overlooked because symptoms of the disorder may be somewhat vague, and parents and doctors may not notice the subtle slowing of development at first. Stage 2 usually begins ages 1 and 4 and may last for weeks or months. Its onset may be rapid or gradual as the child loses purposeful hand skills and spoken language. Ringing, washing, clapping, or tapping, as well as repeatedly moving the hands to the mouth, often begin during this stage. The movements continue while the child is awake but disappear during sleep. Breathing irregularities such as episodes of apnea and hyperventilation may occur. Some girls also display autistic-like symptoms such as loss of social interaction and communication. Walking may be unsteady and initiating motor movements can be difficult. Stage 3 usually begins between ages 2 and 10 and can last for years. Apraxia, motor problems, and seizures are prominent during this stage. However, there may be improvement in behavior with less irritability, crying, and autistic-like features. Many girls remain in this A pediatric neurologist, clinical geneticist, or developmental pediatrician should be consulted to confirm the clinical diagnosis of Rett syndrome. Rett syndrome is clinically diagnosed by observing signs and symptoms during the child's early growth and development and conducting ongoing evaluations of the child's physical and neurological status. Scientists have developed a genetic test to complement the clinical diagnosis, which involves searching for the MECP2 mutation on the child's X chromosome. Although there is no cure for Rett syndrome, treatments address symptoms and provide support. Speech-language therapy can help improve a child's life by teaching nonverbal ways of communicating and helping with social interaction. Occupational therapy may improve purposeful use of the hands for activities such as dressing and feeding. Physical therapy can help maintain movement, create a proper sitting position, and improve walking skills, balance, and flexibility. Medications may help with problems breathing, seizures, and reducing blood pressure. The uses of braces or splints can help children who have scoliosis or require hand or joint support. Now let's check your knowledge of Rett syndrome. The answers will be revealed in the next few slides. Question 1. What is Rett syndrome? A neurodevelopmental disorder that affects boys. B, a neurodevelopmental disorder that affects girls. C, a neurocognitive disorder that affects boys. D, a neurocognitive disorder that affects girls. Question 2. Rett syndrome is an inherited disease. True or false? Question 3. There is no cure for Rett syndrome. True or false? Question 4. Stage 2 of Rett syndrome occurs at A, B, C, D. Question 5. What causes Rett syndrome? A, B, C, D. So how did you do? Question 1. What is Rett syndrome? B, a neurodevelopmental disorder that affects girls. Question 2. Rett syndrome is an inherited disease. That is false. Question 3. There is no cure for Rett syndrome. That is true. Question 4. Stage 2 of Rett syndrome occurs at C, ages 1 through 4. Question 5. What causes Rett syndrome? A mutation in MECP2. Now let's look at a case study. Sally is a 4-year-old child with Rett syndrome. She is in the preschool self-contained classroom at ABC Elementary School. She lives with both parents at home and has no siblings. Sally has shown a decrease in social interaction and communication. Her teacher has expressed concerns of her falling because of her walking has become unsteady and she has difficulty holding on to things. Sally's teacher says that Sally bursts out crying for no apparent reason. She requires a great deal of assistance to complete most classroom tasks. On a recent psychoeducational evaluation, Sally was given cognitive, communication and language, behavioral, motor, and adaptive assessments. Her cognitive skills were measured with the DAS-2 and fell in the low range. Communication and language skills were assessed using the CASTLE. Her scores on this assessment fell in the very low range. The DAS-3 parent and teacher interviews indicated concerns with learning problems, withdrawal, and externalizing problems. Motor coordination skills were assessed with the Beery VMI. Her scores on this assessment fell in the low range. The ABAS-3 was used to measure adaptive skills. Her scores fell in the low range for conceptual and practical domains and very low range for social domains. Treatment and interventions for Sally include receiving speech therapy at least twice per week in a small group setting and physical and occupational therapy in an individual setting for at least once per week. Since Sally requires a great deal of assistance in the classroom, she would benefit from inclusion services daily from a special education teacher to work on academic skills. Both the teacher and parents will receive reports of Sally's progress with these interventions quarterly. This slide contains links to helpful resources for Rett syndrome. Here are a list of references I used. I hope this presentation was informative and helped you learn more about Rett syndrome.